All right, I tried something different, but it didn't work out the way I thought it would. Good afternoon. It's Tuesday. It's time for your daily Scurry County briefing on COVID. I'm Dan Hicks, County Judge here. Let's start out with the Texas tests. There have been 205,399. A week ago, April 14th, that's 7 days ago, there were 158,547 tests in the state of Texas. In the hospital currently, there's 1,419. A week ago, there was 1,459. Total cases reported in Texas today is 20,196. 1 week ago, it was 16,455. In the U.S., there have been 813,589 cases. Just 1 week ago, there was only 576,695 cases. Fatalities in Texas, 517. A week ago, it was 393. In the U.S., there have been 45,013 deaths to COVID. There's been 3 months since the first COVID case in the United States. And I heard today that this is now the leading cause of death in our country. So that's something to think about. Patients recovered in Texas, 6,486 last week, 3,677 on April 14th. In the U.S., there's been 82,620 that have recovered. 198 cases have reported in Texas. A week ago, it was 191. Now, for Scurry County, there's been 111 tested. A week ago, there were 69. There's 14 pending cases. There were 3 last week. There's 95 negative cases, and there were 64 last week. We still only have 2 positive tests here in Scurry County. I talked a little bit yesterday about Moore County. That's Dumas. The population in Moore County is 20,000. And inside Dumas, inside the city limits, it's about 14,000. Let me give you some numbers on them. So you kind of understand where my thinking is, and I think where the governor's thinking is. So in Moore County, 1 week ago today, April 14th, there were 36 positive cases. Today, there's 139. 1 week, 103 more cases in 1 week. They had tested 218 a week ago. They've tested 378 today. There were no deaths a week ago. They've had 2 people die of COVID in 1 week. So when we talk about reopening and going forward, I know it's frustrating. It's frustrating for all of us, and I know it's more frustrating for some. I understand that, and I know that. But we have to be extremely careful when we do this. In 1 week, from 36 to 139 cases. I don't want to do that here in Scurry County. So we're going to do this as slowly as possible if I have any thoughts about it. So when we do reopen, right? So today at Commissioner's Court, we decided that we're going to follow along with the state and do retail to go reopening, basically. And what that means is that and you can find this information on our website. It's DSHS guidance for employers, employees, and customers. And I talked about this a little bit this morning. Employees of retail stores, what they should do, how to keep themselves and their customers safe. And then it's if you're a customer, if you're a customer of a retail store that we're allowed to reopen, then you will be able to go and pick up outside. You won't be able to go into the store. You'll be able to have it delivered by mail or delivered to your doorstep. All payments should be done over the phone or internet if possible, and contact should be minimized if remote payment is not available. If you're getting something picked up, if you're going curbside, the employee of the business should put it in the backseat of your vehicle, or in your trunk, or in the bed of your pickup, whenever possible, to minimize physical contact. And then the employees must wash or sanitize their hands after each interaction with customer, and disinfect any item that came in contact with the customer. Delivery to the doorstep. Do your payments over the phone or over the internet. Um, Delivered by an employee or third-party carrier and delivered to the doorstep. The employee or third-party carrier may not enter the customer's house or business. Delivery by mail. That's as mail is. You do it payment over the phone or on the internet, and it should be delivered by mail without customer contact. Customers should wash or sanitize their hands after the transactions here. Um, it's also requiring employees to wash their hands. They're also going to have to do testing, screening when they get to work, and they'll be looking for a new or worsening cough, shortness of breath, sore throat, loss of taste or smell, fever equal to or greater than 100, or any known close contact with a person who is lab confirmed to have COVID-19. And if an employee meets any of those criteria, they'll be sent home or should be sent home. And employees must wear face coverings and maintain at least 6 feet separation from one another. And those are the guidelines from Texas Health and Human Services. So um, we're going to continue to open as we go along over the next few weeks, but we're going to do it cautiously. We're going to do it in a way that doesn't spread any more of this COVID. Like I said, I know we only have 2 cases, and it looks like we're going to maintain that, but we just don't know for sure how long we're going to be able to maintain that. I'm hoping we do forever, and I know that businesses are getting frustrated. But there was something that I didn't say this morning that I should have, and I'm going to say it now. I would, I don't want to lose any people, and I don't want to lose any businesses, but I would rather lose a business than lose any person to this disease right here. Um, that's just my feelings on it. I think we have enough that takes people away from us, and if we can avoid this COVID taking anybody away from us, especially in this time where we wouldn't be able to have a funeral or grieve properly, then I would rather avoid that. So hang in there. We're working on it. We're all in the same position from all the way around the world, basically, and especially here in Texas. But we are going to open up. We're going to open up slowly. Um, with that, keep wearing your gloves, your mask, social distance, wash your hands. I know we're getting tired of washing our hands. Don't touch your face. It's a hard habit to break. And keep yourself, your family, and your coworkers safe. Thank you and have a good afternoon. Tomorrow I'll try to bring somebody that's more interesting than me here and we'll have a conversation with them. Thank you.